Welcome to the parshealthTV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about why eating disorders are so hard to treat. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. Eating disorders are stubborn. Anorexia, especially, can stick on despite the most reasonable up-to-date therapies. Only 50% of individuals diagnosed with anorexia go on to make a full recovery. Even with prompt, specialist attention, 40% of sufferers fail to recover fully. But why does this happen? We are going to discuss the reasons. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. Eating disorders are one of the noisiest mental illnesses. When your mind and body are compromised by such a debilitating illness, it can endanger your life. A significant feature for people who live with eating disorders is to avoid the substance that fuels their addiction. For people with this disorder, the body requires food to live, and you cannot avoid eating to help your recovery. It's an endless struggle you're faced with several times a day. Many factors such as physical, verbal, or even sexual trauma can link to the beginning of an eating disorder, and these elements can later be triggers that impact recovery. The voice inside your head can resurface anytime when triggered by trauma reminders. However, selecting a way to recover can assist quiet the voice enough to move beyond surviving and start living. Individuals may not notice that you are struggling early on or ever. Eating disordered thinking takes control gradually, and you may not recognize what is happening until you seriously struggle physically, emotionally, and psychologically. For individuals with restrictive food manners or who work out compulsively, the closest people to them might think that if they eat healthier or exercise more, they are making healthy options. People are often validated and motivated to keep up these new healthy routines. They are often congratulated on their weight loss, which toughens their behaviors. But contrary to a widespread view, eating disorders don't look a particular way. People can be underweight, normal weight, or overweight and still struggle with the life-threatening problems of eating disorders. When you don't look the way people consider eating disorders should look, individuals may ignore your issues, and you may even miss them yourself. Having others disregard your problems can make it hard to ask for help or remain engaged in treatment. Remember, you don't have to look for a certain method to be deserving of service and support. As 30 million Americans suffer clinically significant eating problems at some time in life. Anorexia takes an extreme psychological toll on patients. Depression is often a code diagnosis. Hunger wreaks havoc on the body and the psyche, and people with anorexia suffer from a long list of physical signs that, at their most severe, are life-threatening. Approximately 7% of people diagnosed with anorexia will die from the disease. Half will die from suicide. The other half will succumb to the physical difficulties that result from severe hunger, most typically cardiac arrest. Discovering treatment becomes more difficult as the disease progresses. The more physically sick the patient, the less possible they can be accepted to a facility specializing in treating the psychiatric part. And when it comes to medical maintenance, few hospital-based healthcare providers understand the disease's psychological components. Unfortunately, some mental health experts aren't well equipped to treat someone with an eating disorder. So, it is essential to research to find the proper team of mental health experts such as a psychiatrist, psychologist, nutritionist, and support network of friends and family to support your focus on how to recover and stay well. It's also essential to know that recovery is more likely to happen with the proper support. It is frequently said that eating disorders share features of addiction and should be approached only by disrupting and altering eating habits. Some now claim that genetic dispositions are crucial and that identification would improve prevention. Some researchers concentrate on distortions of self-perception within some regions of the brain. These paths are all worth exploring, but now, they amount to little more than redescriptions of well-known points, that relapse and persistence are typical even when threats are identified, that many people share with anorexics a desire to be thinner, but only some suffer from the clinical condition of anorexia, and that those with anorexia harbor distorted thoughts of their bodies. Another reason is that individuals who suffer from eating disorders, mostly young women, keep them secret until they are deeply ingrained and problematic to root out. Some parents tell their anorexic teens as evasive or full of normal-sounding excuses for not eating this particular meal, or even devious in their struggles to avoid being considered accurately. It is said that their eating disorders are kept secret because they are embarrassed by them. While most teens are oppressed by their parents' concerns and, on some level, desire to be the healthful person their parents want them to be, teens suffering from anorexia and bulimia often say, in effect, "What you call my eating disorder is not really a concern, but an answer to my problem." Healing from the situation is considered a threat, not a desirable result. Fatphobia, a pathological fear of fatness, is only one element of insidious cultural views about female beauty and desirability. However, it has an exceptional reach. Supported by, often false, arguments about health and occurring from any gain in weight, it is efficiently internalized by teens as they concentrate on how they are seen by others. It resonates with the idea that girls should be without their own appetites, that control and self-denial are their purviews, and that they are qualified for less physical and social space. While few, if any, parents or experts concerned with teens have such beliefs, at least explicitly, our teen girls are absolutely absorbing them from somewhere. It is time to filter this fear of fatness out of the more public package of social pressures, so we can find their source and our role in their distribution. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.